Hi friends, my name is Dr. Phani Krishna Ravula. I'm a gastroenterologist. Obesity is of course a big common problem in the society these days, and the way to lose weight in obese patients is a combination of diet and increased physical activity. Diet mainly cut down your sugars, cut down the processed carbs and the junk food, increase the fiber intake, and of course increase physical activity. But there are of course a lot of patients who, despite adequate diet, trying their best, they are unable to lose weight, or patients who are severely obese, who have obesity related problems like diabetes, hypertension, high cholesterol, cardiac issues, breathing issues and all that, who may look for something beyond just diet and exercise. So in these patients, this weight loss drugs are relevant. So we basically have two new weight loss drugs in the market right now. One is Mounjaro, tirzepatide, which is available in injectable form, and Ozempic, semaglutide, which is available in India in a tablet form. These two drugs are basically, they help in blood sugar control and also weight loss. So they are anti-diabetic drugs which also have a role in weight loss. Their basic mechanism of action is that they're GLP-1 agonists. So what GLP-1 agonists do is basically they stimulate the pancreas to produce more insulin, allow decrease the sugar production from the liver. They increase the insulin sensitivity. So let's say you're a type 2 diabetes, which most of the people are type 2 diabetics, and the insulin production is adequate, but there's insulin resistance. So an important action of these drugs is to increase the insulin sensitivity, thereby reducing the sugar. And also they slow down your digestion process. They slow down the gastric emptying and the digestion process, reduce your appetite, and thereby lead to weight loss. So these drugs, depending on the dose, they've been been available at least for the past 5-6 years in the West. Depending on the dose you use, they cause up to 10 to 20% of your whole body weight. Upper limit is 22.5%, lower limit is 10%. So let's say you're an 80 kilo adult, you can expect 8 to 15 kilos of weight loss on these drugs. So that's the kind of weight loss they achieve by all these mechanisms: the insulin sensitivity, decreased appetite, slowing down the digestion and all that. And these drugs are generally well tolerated. So well tolerated, what are the advantages of these drugs? One is they're fairly well tolerated. Their main side effects are the GI side effects. You can have nausea, bloating, diarrhea and all that, and heartburn, abdominal pain and those kind of complications. They do cause 10 to 20% of weight loss. You can avoid surgery with these drugs because you actually don't need to undergo a bariatric procedure or something with the slight risk of complications. So these are the main advantages of these drugs, and they have some other additional beneficial effects like you could actually, people have said that they've reduced alcohol craving, reduced smoking craving, and reduced craving for calories. So de-addiction also, they might have some role. But the main disadvantages are obviously the GI side effects are a significant disadvantage in about 5 to 10% of the patients. Because of the GI side effects, you may have to actually stop the medication. They are expensive. The cost of these drugs may come to about 20,000 per month. And what happens once you stop the drug? So this is a controversial point. There are two ways of looking at it. There is some people who say that you need to continue these drugs lifelong to continue the weight loss, and there are some people who say that once you stop the drugs, after a couple of years, your metabolic set point gets altered, so you need to follow a strict diet and lifestyle. You can sustain the weight loss. First thing, these drugs are not to be prescribed by any of us, including gastroenterologists. They should be prescribed only by a trained endocrinologist, and with careful monitoring, rarely, because they can have serious side effects such as pancreatitis also. But majority, like I said, it's only a GI side effect. So the bariatric surgery, so which is better? Compared to the weight loss drugs like Mounjaro and Ozempic, the bariatric surgery, especially surgeries like more than sleeve gastrectomy, like gastric bypass, Roux-en-Y gastric bypass, we do mostly either of these two for majority of our patients, very less sleeve gastrectomies. The advantage with these are one-time procedures. Then they have sustained weight loss. Usually with a gastric bypass or Roux-en-Y, weight regain chances are less unless you're a severe alcoholic or you are into a lot of binge drinking of chocolates and ice creams and all that. So that sustained weight loss remains, and it's a one-time procedure. And of course, they are much more effective in curing your comorbidities. Like once you get the bariatric surgery done, your diabetes is reversed. It's completely, you're cured of diabetes, your hypertension is cured, your obstructive sleep apnea. So a lot of across the board benefits are there with bariatric surgery. The problems are, of course, it is all said and done, it's a safe surgery, it's a laparoscopic surgery, but there's a 2% risk of complications, and then it alters your gut anatomy in some way. Some of these surgeries are not reversible, so you will have to take some supplements. To summarize, which option is better? Is it the Mounjaro and semaglutide versus bariatric surgery? So my suggestion would be, in patients who, obviously diet and exercise are the first line. But if your body mass type is endomorphic and despite diet and exercise, you're not able to lose weight, then the first line in class 1 and 2 obesity, when your BMI is less than 40, would definitely be these drugs, Mounjaro and Ozempic. So if when your BMI is like less than 40, class 1, class 2 obesity, you should try these drugs. And if after like 6 months or something, if you're not tolerating the drugs or there's no weight loss, then you can think of bariatric surgery. And then patients with class 3 and class 4 obesity. In class 3, you could debate that you may try drugs for some time, but patients with class 3 and class 4 obesity, your BMI is more than 40, class 4 is way more than 50, bariatric surgery would be the first choice, because it's a one-time procedure. It will safely lead to sustained weight loss and leads to a significant weight loss, because patients, let's say once your BMI crosses 45 or something, your excess weight is around 60-70%. You would need to lose about 40-45% of your excess body weight. So these drugs may not be effective. So that is what I say. Definitely these drugs are welcome. They are well tolerated, to be taken under a medical supervision. Unnecessary quack prescriptions for cosmetic reasons are to be avoided. Only to be prescribed by endocrinologists and as first line drugs for class 1, class 2 obesity. But for patients with severe obesity and patients in whom these drugs fail, bariatric surgery is relevant. And of course, whatever you do in obesity, be it bariatric surgery, be it drugs or other thing, especially alcohol, food cravings like junk food, processed food, calorie, sweet tooth, all that has to be avoided. That is the basic that stays same on there. For any further queries, you can visit our website or contact us. Thank you.